Welcome to BizTech Health and Wellness Show. I'm Sharon Chang, and today on our show we have Dr. Nick Muhammad Aslan Abdullah and Dr. Aqilah Othman. Both are clinical oncologists from Sunway Medical Centre. In conjunction with World Cancer Day, which falls on the 4th of February, today's focus will be on cancer, and the theme is genetics versus lifestyle, how to reduce cancer risk. Welcome to the show, doctors.
Morning, welcome. Thank you.
Doctors, firstly, can you tell us what is cancer? Maybe Dr. Aslan, you can explain on that.
Okay, in the most simplest form, cancer refers to cancerous cells, which are normal cells which are normal and are growing in an uncontrollable manner. So this is simplest form.
I see. Okay, Dr. Aqilah, maybe you can share with us how many types of cancers are there, and what are the warning signs?
So in terms of cancer, first of all, it can happen anywhere throughout the body. So top to toe, basically. So when we talk about the types of cancer in itself, there are more than 100 actually, like proper types of cancer. But obviously, there are more common ones compared to the rarer ones. And, the things that you see in statistics, in, newspaper, articles, media, they are just the top few that are, more commonly mentioned. Okay. In terms of warning signs, if you think about cancer, how it first starts to start off with is literally, a group of cells that become abnormal and it starts to grow out of control in an uncontrollable fashion. So when they are actually small, you probably don't have any warning signs. Okay, only when it grows to a certain size, when you can actually feel it or see it, then obviously you feel it and see it, it becomes more obvious and more apparent. So in general, it can be as early as possible. In other words, you do not see any signs, but it can become a bit bigger and it causes problems depending on where it is.
I see. Okay, if there are no warning signs, would it be more risky? If patients come to you and would it be in a later stage of cancer?
So that's why when we see on the statistics, the people who present with cancer in general, most are picked up in later stages or advanced stages. So this is where the screening programs come into play. So this is where you find cancers at a very early stage and get it treated early. So this is also when, the cancers do not actually have signs because you're either picking it up in a very early stage or even before it turns into cancer. So at the precancerous stage.
I see. Okay. Doctors, when it comes to cancer, there are always two school of thoughts, right? Some say that cancer is a genetic disease, while others might say that it's due to environmental exposures. So, doctors, what is your opinion on this? Maybe Dr. Aslan, you can go first.
Okay, the answer is not simply black and white. Both plays a combination. It is true that some cancers are caused by genes that you inherit from your family, but those types of cancer, those category of cancers, only the most occurs in 5 to 10% of cases. So those are the known genetics that we know. But the most of the cancers are in interplay between our lifestyle, our diet. Genes also plays a role also. So the answer is that it's a combination of factors, not one factor only.
What about you, Dr. Aqilah? What's your opinion on that?
So I very much agree with Dr. Aslan. So technically, there are multiple factors that basically can increase the risk of cancer. However, you can't put it down to one factor per se in the majority of cancers because you do actually find people who are fit and well, undergo a very healthy lifestyle, do not have any family history, and then, they end up with cancer cases. So you can't say for definite what is the actual cause in many, many cancers. But obviously, there are certain cancers where we know for definite what the causes are. For example, some that are virus-driven, some where you have a very strong family history, then you kind of, you are able to actually link it to certain causes. And obviously, there are certain, certain lung cancers, for example, that are smoking associated. Then obviously, there are these kinds of cancers where you kind of think, actually, the lifestyle plays a very, very big factor. But the majority of which is a combination of multiple factors.
I see. In the latest 2012 to 2016 Malaysian National Cancer Registry report, cancer is still most commonly detected among Chinese, followed by the Malays and then the Indians. However, when compared with the 2007 to 2011 report, there was a decrease in the incidence rate among the Chinese and Indians, while the increase is seen among the Malays. So Dr. Aslan, this is actually remarkably interesting. How do you think our cultural backgrounds and lifestyles affect certain types of cancer?
Yes, I do agree. That is an interesting question that I've been asking myself, and my patients and the public also been asking me, why do Chinese tend to get more cancer? Now, this is true not only in Malaysia, but also in Singapore. To me, I believe, as you pointed out, lifestyle plays a factor also. Now, there are no specific studies looking at the Malaysian Chinese, trying to explain why does the Chinese tend to get more. And then, as you pointed out, the incidence of cancers in Malays are increasing. Now, to me, I believe those are due to lifestyle, which are we are more adopting a more urban, a Western lifestyle. I think and why is the Chinese incidence decreasing? I think that might be probably to awareness. Maybe that they are more aware that they are more at risk, so probably they seek treatment early. And then also there, as you mentioned, there are also like cultural sort of beliefs, stigma, with having cancer, probably have different perceptions of treatment. If I can point out, a study from China recently published last year, which was very interesting. Because China, in China, it's the population is mostly Chinese.
Yes.
But there, they found out that the incidence of cancer was remarkably different when they compared to the urban coastal areas and those in the rural areas. So in the urban areas, in the cities, they are the cancers they are seeing are similar to what we are seeing here, which are breast, colon, and lung, the top three. But when they go to the rural areas, it's different. Of course, they still have lung cancer because the incidence, a lot of their population are smoking. But the number 2 and 3 are liver and esophagus cancer, followed by also stomach cancer. So from that study, it sort of points out that lifestyles, our diet, our physical activities, I think it plays an important role to explain the incidence between the different ethnicities.
So in Malaysia, Dr. Aslan, lung cancer is still the top 3 cancer, yes, right? So what kind of profile would you actually say belong to this high-risk group?
Okay, smoking is still the main risk factor. Someone look at this, and I think the data was gleaned from the MOH statistics that about lung cancer in Malaysia, about 90% are associated with some form of history of smoking. But saying that, now from my practice, I'm seeing more and more non-smoking associated lung cancers coming in, especially among ladies, never smoker, and young. Now, how do we explain that? One theory is that probably it's due to pollution or passive smoking. But the cases of non-smoking associated lung cancer has actually been increasing. I don't have the latest statistics, but comparing 1990s, there was one study by University Malaya. They showed a twofold increase in
Okay,
non-smoking associated lung cancer.
I see. And what can be done to lifestyle changes in reducing all these risks?
Okay, the most important thing I think is smoking. Smoking still plays an important role. That is proven. Another thing, early recognition of symptoms, of early symptoms, and then awareness, because some of them, they don't think, oh, I'm still young, I couldn't have lung cancer, and they put off their cough or the chest pain to something else.
So nowadays, the younger generation, especially the millennials, right? Instead of they are switching to vaping. So does actually vaping reduces the chances of developing cancer?
I think the jury is still out. I don't know. Maybe Dr. Aqilah, maybe you have any information on that?
I don't think we have an information per se at the moment, but certainly if you think about it, your lungs act like filters. So, something that is not meant to be there and you keep insulting your filters unnecessarily, at some point it's going to cause problems. So if you go back to the reason why cancer develops and things like that, so if you have ongoing insult in cells, then they are not able to repair themselves and they're not able to regenerate properly. So obviously, that in itself can increase the risk of cancer forming because you can't actually repair your cells properly. So if you do things like, for example, vaping periods of time, and even if you do not have any sort of genetic predisposition, etc., the theory is probably you're going to have inflammation in your lungs, which is in general not going to be there anyways. And if you do this for a long time, then chances are you might increase some sort of abnormalities in your lungs, i.e., it may lead to cancer of some sort.
Okay, Dr. Aslan, based on your experience, can you share one of your case studies whereby you have actually advised a patient to change his or her lifestyle habits and how these changes actually affected their journey in cancer?
Okay, okay, I would say most of my patients, I do not need to advise them on changing their lifestyle. They would, to some extent, undergo a transformation by the time they come to see me. So if they're a smoker, they would stop smoking. When I see them, we'll ask them, are you a smoker? Yes. When did you stop? Oh, okay, I've stopped. And the wife would say, oh, he just stopped last month after the biopsy result. And another thing, they would change their lifestyles, some of them drastically. They gather all this information overload from social media, from the internet. So they change their lifestyle totally, with some of them even becoming vegetarians, and some of them on very restrictive diets. But most of the change in lifestyle I see is mostly the emphasis is on dietary changes, smoking, but things like lifestyle sort of to reduce your risk. That one is a bit of lacking, such as things that has been recommended and shown to reduce cancer risk as exercise, eat more fruits, eat more vegetables. That one sort of less emphasis when patients are talking about changing their lifestyle.
Dr. Aslan, I just want to mention this. I have heard of people who have been smoking for many, many years, maybe 20 over years, right? And at the end of the day, they still did not develop cancer. Why is that so?
Okay. So in that case, probably genes. Probably they have some protective genes. But it's true. I do know of a few people that are chronic smoker, from they're young until they're now probably 70s, and they don't get cancer or any other diseases. But I would say they are the minority. It does happen, but the majority of cases, they will get some effect from smoking. Not necessarily from lung cancer. They may get other cancers.
Okay.
And they may also have other effects of smoking, such as on the heart or other organs.
Okay. Dr. Aqilah, as a woman, myself, right, I must ask you about breast cancer and cervical cancer. Referring to the same report which I mentioned earlier, cervical cancer cases actually dropped between 2012 to 2016 as compared to 2007 to 2011. So however, Malaysia reported there's a significant increase in breast and colorectal cancer. Why do you think this is so?
It's difficult to point it to one single factor per se, but I think screening does come into play and also increase awareness. So the more screening that you do, you tend to pick up cancers earlier. So that's why you probably see the rate of breast cancers, colorectal cancers are probably on the rise. At the same time, the cervical cancer screening. So if you're picking up things at the pre-cancerous stages, so they've been treated and they've not turned into cancers, then probably that has an effect in reducing the number or incidences of cancer in cervical cancer. And obviously, in terms of cervical cancer as well, you probably will see that the incidences will probably drop over time as well, because now we have the HPV vaccination program. So that in itself, hopefully, will prevent more and more cancer cases, which we will see in years down the line. So there are things like that. So in terms of initiatives and things that can alter certain cases. So basically, like cervical cancers.
So, okay, my daughter, when she was in her teens, she went for the vaccination. Yeah. So does it actually guarantee her that she would not develop cervical cancer?
I think the majority of cases of cervical cancer on the large whole basically is due to the HPV virus. So technically it is actually a preventable disease. But if you think about it, it's not just about females, because you're talking about someone who is not sexually active yet. So it's also important to actually have a think about vaccinating young men before they're sexually active, so that actually it goes on both sides. Okay.
Okay. All right. So when it comes to breast cancer, Dr. Aqilah, and cervical cancer, can you share with us what you have actually, the factors that has mattered most? Is it due to age or dietary, etc.?
So I think any cancers, not just breast or cervical cancers, increasing age is actually in itself a risk factor, okay? Because the older you are, the chances of you repairing your cells is going to become less and less, because it becomes more difficult for your body to do that. So, you cannot change your age the same way that you cannot change your family. So in terms of family history, etc., if you have some sort of strong family history, although the cancers that are due to the family history is probably pretty low in comparison, but if you do have a strong family history, in other words, your immediate family members all have some sort of breast cancers or ovarian cancers at a young age, then the chances of you probably having that is probably slightly higher without getting tested, obviously. So you just need to be more aware with regards to that. In terms of lifestyle factors and things like that, there is associated risks if you are overweight. So you're more on the heavier side. So clearly that can have an impact in terms of breast cancers, etc. So in terms of cervical cancers, clearly, we mentioned earlier, it's actually HPV driven. So that is virus. Okay, so it's technically, lifestyle changes, and you think about multiple sexual partners, etc. But obviously vaccination helps.
I see. Dr. Aqilah, you mentioned about age. Obviously, we can't change our age, but are there like supplements that actually would assist us or help us that, to maybe prolong or, the chances of developing cancer or not even developing cancer at all?
So there are no supplements per se that I know of that actually can do that for definite. So there's no data on any medications out there that actually says that if you take them, that actually reduces the risk of your cancer. But as you say, you can't change your age, you can't change your family. So there are lifestyle risk factors that you can actually alter and be in control of yourself. So main thing is obviously maintaining a healthy weight. having a good lifestyle habit, so regular exercises. And obviously, when you look at your dietary factors as well, what happens these days is that, we go more and more into processed food, rather unhealthy sedentary lifestyle. So these are things that we all can change. If you're smoking, stop smoking. If you are exposed to passive smoking, then you tell whoever in your family who are actually smoking to stop smoking. So all of these things you can actually change and try and reduce. So even if you do not have any sort of genetic tendencies, but if you do these little measures, then hopefully it can promote a better lifestyle. And obviously it's not just the risk of cancer, so it's also the risk of your obesity, your heart disease, your hypertension, etc. is all going to be reduced. So that in itself creates a more healthy well-being, and the chances of you, even if you do develop cancer, then it's much easier to manage.
So in your practice, Dr. Aqilah, can you share with us one case study on how early detection actually can really make a difference in breast and cervical cancer?
So when you talk about early detection, right? So early detection at the screening level, so basically these people do not have any symptoms, okay? The best is actually picking it up before it turns into cancer in itself. So in other words, the cells have just turned abnormal, but they are not cancerous. So when you talk about these cases, it's very easily managed just by surgery. Okay, so the cost is much lower because you only need a single method of management. So in other words, you just have surgery and then you go on to follow up and regular screening thereafter. If you actually go on to a later stage, in other words, you pick it up slightly later, then these probably need to be managed in what we call a multimodality treatment. So it's not just surgery. You also need to think about, other options to try and reduce the risk of cancer. So, this comes maybe either with hormonal treatment or chemotherapy or radiotherapy. So obviously, when you add all these other sort of treatments, when it's picked up in a slightly later stage, it takes longer for treatment, number one, and obviously it does affect the quality of life in the short term because you need to come into hospitals, get treatment, etc., and obviously the cost increases. So if you pick it up early and you are, regularly going for early interventions like screening, etc., it's much easier, much easier to manage, and it's very simple for the patient. So, and then get treated and get back to normal life.
So, Aslan and Dr. Aqilah, in Malaysia, cancer is the second highest cause of death, right? Accounting for around 16,000 deaths in 2018. So the number of new cancer cases in Malaysia has also increased by 11.3% in the last 5 years. So since it's World Cancer Day coming up soon on the 4th of February, do you have anything else which you want to share with the audience as a last final thoughts? Maybe Dr. Aslan, you can go first.
Okay, I think Dr. Aqilah has mentioned a lot of screening. Probably I'll add on to that is that when discussing about screening, some patients are afraid. They're anxious. They're afraid to accept the risk that, oh, if I go for screening, I have cancer. And then when the word cancer comes up, they think of chemotherapy, losing their hair, getting sick from chemo. But I think when we're talking about screening and detecting cancer early, the thing overlooked is that if you're detected very early in an early stage, or as Dr. Aqilah mentioned, in a precancerous stage, the chances of you of not having chemotherapy is very high. If you're very early stage, you may just need some surgery or simple procedure, and everything good. The report is good. It's a very early cancer. Not all cancers need chemotherapy. So that's one thing I would say. I would like to share to the audience that if you detect cancer early, you may get away with not needing chemotherapy, and less cost, less time of work, and better survival, definitely.
What about you, Dr. Aqilah? Any final thoughts for the audiences?
I think exactly like what Dr. Aslan has said. So I think if you mention the word cancer or even chemotherapy, everybody just shudders. But actually it's not as scary as it's made up to be. So even if you do have cancer, if there's some signs or symptoms that you think you may have cancer, Don't just sit at home and like hope for it to miraculously go away completely. Go and check, get it checked out, and obviously get it diagnosed earlier, get treatment earlier. And the other thing that I want to point out is chemotherapy is not as scary as it's meant to be. Okay, so there's a lot of myths around chemotherapy, and when we talk about cancer treatment, it's not chemotherapy alone. So there are many other kinds of cancer treatment, etc. And I think without actually seeing the specialist, seeing the oncologist to have a discussion of what actually is best suited for the disease, you can't actually tell and just assume at home that this is what you're going to get. So I think the main thing is, if you find something's not wrong, find something's wrong, then actually go and get tested. But if it's not wrong, go and get some sort of screening. So actually, it's just a different way of living in a more healthy way.
Okay, doctors, how often should you go for screening actually? As a normal person, just say I have no symptoms and all, so should I go for it like every year?
So if you do not have any family history, etc., and you're well, clearly, so for a woman, okay, above the age of 40, you should already start thinking about going for your breast screening, a cervical screening, etc. Okay, for obviously males or even women above the age of 45 without any symptoms, then you should already start thinking about going for screening, etc. And the reason being, so in the past, the colorectal screening, etc., the ages is actually above 50. But nowadays, what we see is younger and younger people are actually getting diagnosed. So the point where you're talking about where you should be starting to think about screening is probably at the age around about 45.
I see. Okay, thank you so much, doctors, for taking the time to be on our show. We have been speaking to Dr. Nik Muhammad Aslan Abdullah and Dr. Aqilah Othman, both clinical oncologists from Sunway Medical Centre. The video will be on our Facebook and LinkedIn site as well as on our website. Please check.
Thank you very much.
Yes, please check us out for business and technology conversations via articles, podcasts, and videos, and subscribe to our Facebook and LinkedIn pages. Thank you so much, doctors.